I caught COVID, and it's not getting any better. I spent 4 years shielding and now have my second dose, the first since catching it at the end of 2019. Yeah, 2019. I wrote about it last month, having thrown up in the night 5 or 6 times in 1 week, over a month since testing positive for the COVID virus, or SARS-CoV-2, on the 4th of August. The exhaustion stopped knocking me out after the first 10 days, but the persistent nausea and gut disturbance grew worse. Is this the virus overwhelming my immune system? I asked myself in the light of no spring booster, as the government wound down its already pathetic response. At the start of October 2024, I'm breathless after climbing one flight of stairs while talking and carrying something moderately heavy, or speaking a long sentence like this. 3 minutes on the exercise bike shoots my pulse up to 130 or 140, whereas it's always been between 105 and 115. I'm still nauseous, but not throwing up. The brain fog is still bad. Balance and coordination is all over the place like a drunk. Mostly teetotal, I don't bump into things this much even after downing my Christmas Baileys. It makes sense when you read, cognitive impairments in long COVID are debilitating at the same magnitude as intoxication at the UK drink driving limit, or 10 years of cognitive ageing, and may increase over time. Lovely. So I've got that to look forward to. Why is this pandemic still with us after 4 years? This question brings us to the airborne versus droplets paradigm. Until this latest round of COVID inquiry hearings, I hadn't realised that mode of transmission was even in contention. Whether SARS-CoV-2 is transmitted through aerosols or droplets is a rabbit hole I only fell into very recently. It started with a video clip of what I'd assumed was a rare light moment from the World Health Organization's Tedros Adhanom Ghebreyesus, seemingly differentiating the word for the state of the aerosol, airborne, from the US military term airborne at a WHO press conference on the 11th of February 2020. But no, it is an actual immediate retraction. Only 3 days after China's Shanghai press conference informed the world that SARS-CoV-2 is in the air we breathe and requires protection to be stepped up. Tedros is prompted by Mike Ryan to change his classification from airborne to droplet mode. And why is this important? The crucial differentiation shaped the whole of the UK's pandemic strategy, which is one of the deadliest in the developed world, despite our science and resources. It puts the onus on the individual instead of governments and their institutions. It continues the use of cheaper surgical masks, which are inadequate, FRSMs, instead of FP3 or 2 or N95 masks. It ignores adding ventilation and filters to clean the air like they have at Westminster, of course, and fails to add power-assisted respiratory hoods to the armoury, and it doesn't protect health workers, patients, or the public. Yet it was obvious in January 2020 that the virus was in the air and required an effective response. There was a big clue in the shape of hazmat suits. Oh no, not for us, in China. We watched healthcare workers in China struggling in hot, bulky, sweaty, hazardous material suits to contain the pandemic. So what was that telling us? Professor Zhongnan Shan's confirmation of human-to-human transmission on the 20th of January was swiftly followed by the Wuhan lockdown on the 23rd. China then warned the world about the airborne nature of the virus at their Shanghai press conference on the 8th of January. However, little of this got through to us as our mainstream media were busy throwing dust in our eyes with a vicious China-bashing binge turning our cooperation and understanding into a regular 2-minute hate. In scapegoating China, they turned China bought us time into China lied, people died, and buried the management strategy that eradicated the coronavirus by day 43 of a 76-day lockdown. That was the one that could have saved us. This little revelation about airborne versus droplet transmission plunged me down the politicised covert rabbit hole. So why, Tedros? Why? The timing of events surrounding this pandemic have been startling. So many coincidental dates, such as the 18th of October 2019, when the annual military games opened in Wuhan. That's the same day as the Event 201 tabletop pandemic exercise launched in New York. After President Trump called the virus a hoax, stigmatised masks, held super spreader rallies, and generally wasted time while the stock market ballooned and exploded, he was forced into a humiliating U-turn. Enter his Wuhan flu, Kung flu, China flu phase of pandemic mismanagement. The Trump administration issued a 57-page Blame China manual published by Mike Pompeo's mates on the 17th of April 2020. That's the same day that Australia's Home Affairs Minister Peter Dutton and Foreign Minister Marisa Payne did exactly that. They blamed China and started a fight when everyone was supposed to be working together to wipe out COVID. Coincidentally, Oz Prime Minister Scott Morrison had disappeared a few months earlier during the devastating bushfires for a Christmas break on a US military resort in Hawaii. I wonder what he chatted about with his hosts over Mau Tais. Hint, he now works for Trump's former NSA advisor, Robert O'Brien, in the defence industry, as well as the aforementioned Pompeo in a US venture capital firm. And get this, Tedros made his retraction on the 11th of February, 3 days after China's public announcement that the virus is indeed airborne, and only 1 day after President Trump called for a massive 9% or $693.3 million reduction in funding for the CDC, which would have been hard to do if he'd had the added expense of firefighting a highly consequential infectious disease, HSID, as it's categorised in the UK. We know that Trump had pressured the WHO to pin responsibility for the virus on China like everybody else was doing and deflect from his own mishandling of the pandemic. Trump was threatening to defund the organisation. It should be remembered that Tedros's home country, Ethiopia, saw its peace broken later in the year. That's after 20 years, nearly 20 years of peace. So perhaps the big stick was being wielded when the carrot didn't work. Now we get to the UK COVID inquiry. There have been some illuminating testimonies from scientists. Let's pick one who blew my socks off, Dr. Barry Jones. Little did I know at the time of the outbreak of the sharp delineation between droplets and aerosols either side of a 5-micron fulcrum. Neither was I aware of the battle that would cost lives and reputations, but I certainly know now. The UK COVID inquiry of the 12th of September shone a cleansing spotlight into one of the dark corners of the science establishment and brought it into public view. I spent a night reading the transcript of Dr. Barry Jones's evidence to the COVID inquiry, and it is truly a shocker on the scale of the government's care homes decisions, the fatal strategic flaws that killed so many elderly people and their care workers early in the pandemic. Professor Clive Begg's testimony the day before is also worth watching. What we learnt was that the strategy pushed by the government's hastily mobilised IPC cell, the Infection, Prevention and Control body charged with writing the national guidelines on the COVID pandemic, the guidance that everyone was supposed to follow, it might well have killed many more people and helped shift the pandemic's trajectory into a malign multiverse I'd rather not belong to. Did you know that something called the precautionary principle is enshrined legally in the UN, the World Health Organization, and SAGE documents, as well as in health and safety legislation? Dr. Jones explained at the inquiry what this means. He said that, as by their own admission the IPC cell didn't understand everything, They were under a legal obligation to choose the safest approach they could take that would protect the greatest number of healthcare workers, their patients, and the public as a whole. If there could be a risk, you should take steps to mitigate that risk. If you think asbestos in the building, he said, you don't think about it, you put on a mask. The precautionary principle wasn't needed prior to the 13th of March because the virus, SARS-CoV-2, was already classified as airborne by the Joint Committee on Vaccination and Immunisation, the JCVI, ever since its arrival in the UK, officially January. MERS and SARS were already ascertained to be airborne, highly consequential infectious diseases, HSID. In the case of a respiratory pathogen like SARS-CoV-2, you have to assume it is transmitted by the airborne route like TB and measles and previous coronavirus epidemics. He emphasised that the aerosol route was already understood, but even if not, it would be categorised as scientific uncertainty, so the precautionary principle should be invoked as a failsafe. However, the hastily appointed IPC cell that was supposed to write the guidance mysteriously changed that and downgraded the HSID status of SARS-CoV-2 in mid-March on no evidence, a bizarre action way beyond their remit. Dr. Jones said, "It's not for the IPC chair to reinterpret, but that's what she, Lisa Ritchie, did." As a result, the wrong PPE, FRSMs or fluid-resistant surgical masks were advised, the floppies, the baggies, ill-fitting, lots of space. These only prevent droplets that act ballistically, moving under the force of gravity alone, not aerosols that float suspended as fine particles in the air. Aerosols over the 5-micron distinction can enter and escape around the sides of surgical masks. This rendered all IPC guidance null and void. Unfortunately, the IPC cell has turned out to be a law unto themselves. In creating guidance for a new threat, as was the IPC cell's job, it's important to impose that precautionary principle failsafe early on. He said guidelines should have stayed in place until scientific evidence proved credibly there was no aerosol transmission. Dr. Jones told of an incident that proved pivotal in our collective fate. Deputy Chief Medical Officer Dr. Jonathan Van Tam emailed that COVID was airborne until proven otherwise, and there was no evidence for the droplet route, remember. But health and safety legal procedures were abandoned for prevention and control. Dr. Jones said the IPC specialists who dictated guidance made statements not based on evidence. You could even call them dishonest statements. They didn't apply the precautionary principle in the face of scientific uncertainty. They didn't even include natural aerosol generators in the official aerosol generating procedures, or AGPs, such as coughing, sneezing, and even breathing. Well, they even ignored advice on the 14th of April from SAGE's Environmental Modelling Group that the pandemic was likely transmitted by aerosols. And this is where it gets really weird. Public Health England is essentially one of the IPC cell's bosses. They have the authority. They asked several times over 2020 and 2021 for widened use of respiratory protection, but were ignored. Dr. Jones noted that the guidance authors demanded very high-level definitive evidence to prove the airborne route was dominant, while having no evidence whatsoever to justify the droplet one then or since. He said, "It's not scientific, it's a reflection of the culture." Aerosols should have been protected against from the outset. Worryingly, not only the IPC cell, but also the WHO initially categorised SARS-CoV-2 as airborne and then contradicted itself on Twitter and across social media, saying that COVID is not airborne, its droplets and surgical masks are fine. Their claim that they were following the science is untrue. Neither did they offer any scientific evidence. The precautionary principle was removed from IPC guidance in mid-March 2020 without evidence, at the same time as HSID declassification. Now, there are only two categories of HSID, airborne and contact. IPC guidance came in on the 16th of March 2020. It says routes of transmission, COVID-19, similar to 2003 SARS-CoV outbreak. So despite SARS-1 being designated as an airborne HSID from the start, the guidelines say SARS-CoV-2 is transmitted by respiratory droplets. Again, there's no evidence for this. Designated airborne HSID requires standard PPE to include FFP3 masks, not just surgical. So downgrading HSID from airborne to droplet transmitted, except for aerosol generated procedures, resulted in the only protection afforded being against droplets for all non-AGP situations, the majority of healthcare in hospitals. Despite advice urging caution that the disease was airborne with aerosols going up to 100 microns, well above the 5 micron threshold, there were no changes to guidance. SAGE reverted to 5 microns in their June report. The IPC was still disregarding the precautionary principle in December 2020 in a discussion about new variants. Wary of recommending FFP3 masks and should look for new evidence first, and difficult until the evidence is generated. Even more ghastly, after all the raging media hostility against China for supposedly denying human-to-human transmission when Professor Zhongnan Shang had announced this very thing on the 20th of January 2020, after medical staff were infected, and this prompted the unprecedented lockdown on the 23rd of January, the December IPC notes say minimal evidence of patient-to-staff transmission. None at home in the UK? What happened to the mountain of evidence from Italy's experience? How did they get away with this? Well, no IPC minutes were ever published. 28 IPC cell members agreed in 2021 that the chair had the final decision, and overall she did. Requests for precautionary principles to be invoked were denied. 250,000 Brits are dead, with a lot more maimed by the virus. This week, we heard how conditions in hospitals were like a terrorist attack, with no end in sight, with patients raining from the sky. Intensive care units were a scene from hell. And still the IPC and others cover their backsides and refuse to recognise COVID's airborne status. And to demonstrate the airborne versus droplets, the healthcare workers in the high-risk areas who got these in their PPE, the FFP3 masks, respirators, practically none of them came down with it. There were practically no cases of COVID, and there were no deaths. Yet among the healthcare workers in the so-called low-risk areas who were only given the surgical masks, we know there were so many cases and so many of them died. So what the heck have they done to us in the meantime? The pandemic is not over. Wear a mask, an FFP2 or 3 or an N95 respirator. Please, no floppies.